Neuropsychological assessment. When we have to assess the amount of impairment in the behavior or cognitive capacities after brain injury or damage, we use neuropsychological assessment procedures. Various neuropsychological tests are employed to make an assessment of different cognitive functions such as learning, memory, discrimination tasks, intelligence, language, perception, decision making, reasoning, etc. The tests are administered, scored, evaluated, and a complete mental status of the patient is taken. The neuropsychological assessments include a comprehensive examination of behavioral, psychological, and neurological assessment of the patient. These assessments help to get a clinical picture of the patient with respect to his or her cognitive strengths as well as difficulties that may be there in any cognitive or psychological areas. These evaluations help in treating the patient with appropriate medical or rehabilitative procedures. Apart from this, the neuropsychological assessments also provide valid information about the kinds of impairments that may result due to brain damage, injury, or trauma and how to take care of these deficits. The kind of interventions which are needed can be planned to help the client cope with the impairments or how the patient can use other resources to deal with daily life problems which can be forecasted. These assessments thus not only help to diagnose a problem but also provide valuable information about the prospective treatment plan for the patient. The effectiveness of treatment procedures is also assessed so that these programs can be developed to benefit other patients too with similar symptoms. Hence, rehabilitative psychologists can be trained in devising intervention programs for alleviating or dealing with the cognitive impairments after brain injury, tumor damage, stroke, etc. The psychologists gather important information from the patient about the history of the illness, the occurrence, severity, developmental milestones, genetics, or any other factor that may help in gathering a more accurate picture of the patient's problem. Psychologists also use semi structured interviews to know about the development of the problem. There are various diagnostic tests available for neuropsychological assessments. Few of the common neuropsychological tests used are Wechsler Intelligence Scale, the Halsted-Reiter Neuropsychological Test Battery. So, a test battery is a group, series, or set of several tests designed to be administered as a unit in order to obtain a comprehensive assessment of the particular factor or phenomenon. For example, a researcher may administer a battery of health surveys to a group of individuals diagnosed with a particular disease to assess multiple facets of the disease. Depending on the purpose of the testing, individual tests may measure the same or different areas or both and may be scored separately or combined into a single score. The Lurie-Nebraska Neuropsychological Battery, the Ray Osterth Complex Figure Test, Dellis-Kaplan Executive Function System, Digit Span Test, Wisconsin Card Sorting Test, Dichotic Listening Test. So, dichotic means affecting or relating to left and right ears differently, as with the presentation of different sounds to each ear. Wechsler Intelligence Scale. The first version of this intelligence test was known as Wechsler-Bellevue Intelligence Scale. It was published in 1939 by David Wechsler to measure intellectual performance of adults. These scales have been subsequently been revised for adults and children. The Wechsler Adult Intelligence Scale 3 or WAIS-3 is administered on adults. Wechsler Intelligence Scale for Children 3 WISC 3 is administered on children between the age of 3 to 16 years. The Wechsler Preschool and Primary Scale of Intelligence R WPPSIR is designed for children between the age of 4 to 6.5 years. So these are the parameters on your left which are measured by Wechsler's intelligence test. You can see the total intelligence, which is FSIQ, can still be broken down into performance IQ and verbal IQ. Verbal breaks down to verbal comprehension and WMI, that is your working memory index. Comprehension is like what is written or told to you as information and how best you can analyze it and take out conclusions. Having a good comprehension is very important. Classic example is some people read news and cannot comprehend if they are being presented by facts or being manipulated or plainly being brainwashed. Most of the time the middle one. WMI or working memory index is basically they tell you some numbers and till where you can remember and repeat exactly in that order. Sometimes they can also ask you to repeat the number just told to you in reverse order. Similarly, perceptual organization index is measure of non-verbal and in-the-moment reasoning. It assesses ability to examine a problem, draw upon visual motor and visual spatial skills, organize thoughts, create solutions and then test them. An easy example of this is, can you find the odd one out here? Next is PSI. At its core, the processing speed index measures one's ability to scan and understand visual information effectively and complete a task with the data. On your bottom right is the marking of this test, and people fall on it as per bell curve. Meaning, mostly, like 68% to be precise, people fall on the center of the graph, meaning that they have average intelligence that is from 85 pointer to 115 pointer, and as you move right in the scale means you are gifted or genius, and as you move to the left in the scale means life is going to be tough for you. Einstein's IQ is unknown. It has never been tested, but there is no question that he was one of the greatest geniuses of 20th century and would have fell on the extreme right of this graph. The Halstead-Wright Neuropsychological Test Battery. The battery consists of a set of neuropsychological measures which are used by the trained psychologist or a clinical psychologist. This battery is designed to assess all major cognitive, sensory, expressive and motor functions. The test battery is found to be reliable and valid for both younger and older age groups. You can see the Halstead-Wright Neuropsychological Test Battery is not a test but a suite of collection of tests as we saw earlier. So on your right, as we just saw, it is a comprehensive suite of neuropsychological tests used to assess the condition of the brain.